Hello, my name is Ashley Sanders, and I'm a licensed mental health counselor in Florida. I'm also the clinical director of mental health programming here at eTherapy, and I'm here today to talk to you about how we write treatment goals, care plans, and staff discharge summaries. In this training, we will be taking a look at both treatment goals and care plans for the clients you are working with. So far, you have learned about receiving a referral, the consent process, and our brief intake format. In this video, we'll get into the specifics for the next steps, goal setting and care plans, and discharge summaries. Both treatment goals and care plans, the template you follow will vary based on the client. For example, if they are a student or staff member, and if they have a release of information on file or not. During your initial intake with a client, regardless of if they are a student or staff, you'll begin to partner with them on an identified treatment goal. For younger students, we may use collateral information from the school and or the guardians to really identify what we are working on in treatment. These goals should be basic and achievable and apply directly to the client. We can always add additional goals as we reach initial treatment goals. The first thing that we're going to do is select the category within the goal note section. Some examples for this category include reducing aggression, emotional regulation, developing coping skills, etc. You will choose the correct category, including a non-specific one labeled identified goal for students without a release of information, and then you will write a more detailed goal under the IEP goal. It's important to note we are not making an IEP goal, but rather this is the current label for that section in STAR. This goal should be more specific. For example, if you're working on managing anxiety, you will write the IEP goal as student will learn 3 coping skills for anxiety and practice these 3 times a week for 9 consecutive weeks. Or if the student goal was to manage anger, you may write student will be able to identify 3 signs in their body that they are beginning to feel angry and learn 3 coping skills to use at least 3 times a week for 9 consecutive weeks. The goal will be entered into STAR in the client's goal section. Because this section is not confidential, for staff and for students without a release of information, we'll want to keep our own personal log of what goal we are working on in the confidential note section following the first session, rather than the goal note section. I know, that was a mouthful. If you have any questions or need clarification, please feel free to reach out to me or your AM. For the students that we do not have a release for, we're just going to use that identified goal category because that is what is visible on the school side. For clients with the release, we will input the goal in the actual goal field so it is visible to the school. Next, we're going to take a look at care plans. For all Gen Ed students, we will conduct regular care plans on a quarterly basis. Your account manager will let you know the quarterly due dates for your care plans. Care plans let us gauge progress based on the intake screener scores and continue making recommendations to the school about a student's needs. The visibility and content of care plans will change based on if there is a signed release. All care plans should be clearly written and formatted using the template provided. Keep in mind that all recommendations should be related to our scope of practice within mental health, and the recommendation language needs to be open so that the district is not held responsible, but rather has data on what the student has accomplished. Please make sure to use the correct template based on if there is a release of information for the school. This should be uploaded on letterhead to documents and in the Note 2 section. Care plans are going to include an updated screener score based on the initial screener performed, so please remember to do these at intake and include them in your intake document so that they are available for care plans for yourself or another therapist in the case of a transfer. If you receive a student without screener scores, you will note this in the care plan by stating that a screening score was not available for the student due to scheduling concerns. Now let's take a look at what these care plans can look like. You're going to note when you have a release of information that you'll put a lot more information, including the total sessions, the service dates, what their initial screener score was, and what their presenting concern was, as well as what changes we observed academically and personally, including things like behavior, academics, and attendance. Then we're going to make our recommendations. We should make sure that our recommendations always start out with one of these first 3, such as continuing services as appropriate and available, or accessing alternate school based services if needed, or discontinuing services if they have reached their treatment goals. We can also make additional recommendations depending on what a student needs. Things like a mentoring program, a social emotional group, joining a clever sport, a cool down pass, or a check and connect with a preferred adult on campus can be some additional recommendations that we make in conjunction with the school after talking to them about available resources and what is appropriate for their staff and the student. If we do not have a release of information on file, we are just going to be putting the initial service date, last session date at the time of writing this, and one of those three recommendations that we looked at initially. Now let's talk about what we do for staff, since we don't do care plans for staff. Instead, at the conclusion of treatment, either discharge or at the end of the school year, we complete a staff summary note. Each therapist must conduct one of these for every staff on their caseload and then write up a summary note. They should really just be 2 to 3 brief sentences detailing the original presenting concerns, any progress that they've made, and identified areas of continued need. This should go in the goal note section for each staff member for confidentiality reasons. Now let's take a look at some examples. Example 1. Staff presented with anxiety 7 out of 7 days, learned 3 coping skills she is using on a daily basis to reduce anxiety to only 1 time per week, and due to scheduling issues, she is being discharged successfully. Take a minute to look at examples 2 and 3. Awesome. Well, thank you so much for sitting through this training with me so that you feel more confident creating treatment goals, writing care plans, and doing staff discharge summaries. Remember, if you ever have any clinical questions about the content, reach out to me. I'd be happy to help. Or if you're more wanting to know about the logistics of where things go or how to input them, you can reach out to your account manager as well. Thanks and have a good one.